Take a deep breath. Feels simple, right? But have you ever thought that the air you just pulled into your lungs could carry an invisible enemy? Every day, millions of people inhale tiny threats without knowing it. These silent invaders can turn a normal breath into the beginning of a dangerous battle inside your body. Today, on Kainat Rana Worldview, we're uncovering the hidden danger of lung infections, the diseases that quietly steal our breath and sometimes our lives. Your lungs are incredible organs, working around the clock to keep you alive. They expand and contract thousands of times a day, drawing in oxygen and getting rid of carbon dioxide. But while they connect you to the world, they also expose you to risk. The air we breathe doesn't just contain oxygen. It carries dust, pollutants, bacteria, viruses, and even fungi. Most of the time, your body's natural defenses, like tiny hairs called cilia and protective mucus, stop these invaders. But when they slip past, a lung infection can begin. A lung infection happens when germs settle deep into your lungs and start to multiply. Your immune system fights back, causing inflammation. Fluid, pus, and immune cells flood the lungs, making it harder for oxygen to reach your blood. And suddenly, something as simple as breathing becomes a struggle. There are different types of lung infections. Pneumonia is perhaps the most dangerous. It causes your lung sacs to fill with fluid or pus, leading to coughing, fever, chills, and breathing difficulties. Bronchitis inflames the airways and brings a deep, persistent cough. Tuberculosis is a slow-moving but deadly bacterial infection that can damage the lungs over time. And fungal infections, though rare, can cause serious harm, especially in people with weak immune systems. But how do these infections start? Often, it begins with a single breath. You inhale bacteria like Streptococcus pneumonia, viruses like influenza or COVID-19, or fungi from the environment. Sometimes, food or liquids accidentally entering the lungs can trigger infection too. The signs that you might have a lung infection are easy to miss at first. A cough that doesn't go away, fever, chills, chest pain, shortness of breath, and fatigue. In severe cases, your lips or fingertips may turn blue, a sign that your body isn't getting enough oxygen. Some people are more at risk than others. Babies and young children, older adults, smokers, and those with chronic illnesses like asthma or diabetes. People with weak immune systems are also more vulnerable. The good news is, lung infections can often be treated. Bacterial infections respond to antibiotics. Viral infections may need supportive care, rest, hydration, and sometimes oxygen therapy. Fungal infections require special medicines. The key is early detection and treatment, but the best protection is prevention. Get vaccinated against pneumonia, flu, and COVID-19. Wash your hands often. Quit smoking. Your lungs will grow stronger. And if you feel unwell, don't ignore the signs. Seek medical help early. Your lungs are your lifeline. Every breath you take fuels your body, your dreams, and your future. Don't let a silent infection steal that from you. Stay informed, stay safe, and keep watching Kainat Rana Worldview, where we bring you the stories that matter and the knowledge that could save your life.